is surprisingly very little information available for women to understand or navigate the signs or symptoms, not just of menopause, but what we refer to as perimenopause, which is that window of time that can precede menopause by about 8 to 10 years and even follow menopause as well. Understanding these signs and symptoms is so important because not only can they give you a hint or a clue as to the changes your body is either currently going through or about to go through, but it also helps you navigate how to address them head on so that you can be one step ahead of the game. I started in practice almost 2 decades ago as a board-certified dermatologist, and I've joked that for many of my patients, they've aged with me, where when I started in practice, we were having babies together, and now our kids are heading to college, and we're all going through some of the same changes. So I thought it would be interesting to share with you what my patients have experienced over the past 20 years as they go through their 30s and 40s. So each of the episodes of this series are going to be really dedicated to individual signs or symptoms associated with perimenopause as well as menopause. And I'm going to go through these sequentially so that you start to see what signs I started to see initially in my patients and to follow the changes they experienced in their skin, hair, and nails, because sometimes these are some of the first things you might notice, or at least be the most obvious, that it's worthy of discussion. One of the very first signs or symptoms that patients will either discuss or I'll come across on full skin examinations is the development of chin hair. The onset of chin hair growth in women can vary, and yes, it can happen earlier than perimenopause for a variety of hormonal and metabolic reasons. For many women, they'll start to see it at that onset of that perimenopausal window. At the onset of the perimenopausal window is when we start to see those estrogen levels slightly declining, but what we really see is evidence of testosterone, which we all have, and is relatively stable through this window of time. It starts to act unopposed because there's less estrogen around to block. Initially, some women will notice a few dark, coarse hairs or even white hairs. It's intended to develop along the curvature of the chin. They may not be obvious to others, but this is something that we'll tend to feel before we see necessarily. When we're washing our face or just kind of rubbing our chin, we start to feel a couple of stubbly hairs there. Now, chin hairs themselves are not necessarily the sign of a hormonal abnormality. It's really more a sign that hormones are starting to change and that we might start to see progressively decreasing estrogen levels and the impact of testosterone on our skin, hair, and nails. Noting the symptom first can give you a clue as to the next symptoms that I start to see in my patients and that I've witnessed over the past 20 years. There are 3 main ways to address those pesky chin hairs. The first would be the ones that we're all familiar with, are those temporary methods of hair removal: waxing, plucking, threading, shaving. They're all legitimate to do. Always remember that it's perfectly safe to shave those hairs if it's simpler to do so, and that it is an absolute myth that that will make the hair grow back thicker. Many of my patients will find it much simpler to do so simply because it's hard to see them without a magnifying mirror. And again, this is also at a time when our vision is starting to change and it makes it more challenging to see them directly. The permanent methods of hair removal, remember that the permanent method of hair removal would be electrolysis. Electrolysis is considered the gold standard, but definitely very variable from state to state in terms of regulations, as well as variable in terms of results based on the technician performing the procedure. However, electrolysis is considered the gold standard in that it permanently destroys that hair follicle so that it no longer grows a hair. But also bear in mind that the hairs that you're currently seeing in that perimenopausal window are not the only hairs that you're going to witness over the next 10 to 20 years. There will be more coming, so addressing some of those early on may make the process simpler to start by attacking them from a permanent method of removal so that it's less to deal with as you get older. Hair laser, unfortunately, is not as successful for these hairs. There can be some permanent hair reduction with hair laser. However, again, it is not addressing further hair growth, and I find women tend to be very disappointed by the results. And always bear in mind that sometimes hairs along the chin can become ingrown, which leads to hyperpigmentation around the hair follicle, which makes it even more challenging for hair laser to work, as it cannot always distinguish between the pigment of the hair and the pigment of the skin. For many women, they are starting to grow gray or white hairs in that area, and it is completely invisible to laser methods of removal. There is one other method of addressing hair growth. There is the option to suppress its growth. There was a topical available for many years that I believe was discontinued this year called Vanica, which was a cream that could be applied that didn't stop the hair from growing but slowed it down, so that using temporary methods of removal were a little bit easier in the sense that you didn't have to use them as frequently when you use this cream. However, it hasn't been as popular in recent years. There is a pill by mouth that is a prescription medication called spironolactone that many women will take. It is a blood pressure medication, so we have to be very mindful of that fact and do it cautiously and under the care and guidance of your physician. However, spironolactone is known as an androgen blocker, where it can actually block the impact of testosterone on your skin and hair, which gives multiple benefits in that it reduces the growth of hair on the chin, it reduces the tendency towards acne, it can also give a favorable balance of hair growth on the scalp, where simultaneous to the chin hair growth, many women are just starting to notice that their hair quality is changing. It's getting thinner, it's getting wispier and finer. The actual loss of hair may not be as obvious at that point in time, but using a medication like spironolactone could address both aspects of this.